Hi everyone, this is Sean with the MassSupport Network, here with your COVID-19 update for Tuesday, December 29th, 2020. With the Christmas holiday this past weekend, the case numbers are going to be significantly off, so we shouldn't put a lot of stock in what the trends appear to be right now. There will be some underreporting from the last weekend, and there'll probably be some overreporting, and with New Year's coming up at the end of the week, there'll be some additional data irregularities from that. But from what we do know so far, worldwide, we have crossed 80 million cases, a little under 4 million cases more than last week, which is definitely going to be some underreporting there. Here in the United States, we saw about 1.3 million new cases in the last week, which is probably also underreporting. The United States will likely end 2020 with 20 million total COVID-19 cases. And here in Massachusetts, we saw about 30,000 additional COVID cases in the last week. Deaths, which were also going to be affected in reporting by the holiday data slowdown. We saw about 70,000 additional deaths reported in the last week. Worldwide, 17,000 in the United States, and here in Massachusetts, 399 additional deaths from previous week. Looking at things graphically, you can see there how almost all the trend lines just drop off significantly at Christmas Day, when reporting just usually stops altogether in some areas. So tests, cases, and deaths are all going to be kind of unrepresented for a little while now. Looking though at where things stood on the 24th, which last time was vaguely accurate data, there has been a slight downturn, but again, testing has also been kind of falling in the last couple of days since mid-December. So there may be some underreporting there, but the Midwest definitely has continued its decline there. And there's perhaps, there were some signs that perhaps the case counts were starting to come down in the West and Northeast as well. But of course, Christmas gatherings, New Year's gatherings could easily turn those back around. Just to look at the way the data is going to be affected here. This shows the total cases over the pandemic. And you can see first that little blip at Labor Day where we lost our data reporting for a little while there, then the larger drop from Thanksgiving. And now you can see where the Christmas drop has already happened there. And we'll see a second one there. So with two holidays back to back like that, we really should expect to not have a clear picture of what's going on for a few weeks this really. Hospitalizations, however, are the one place that will continue to report steadily, and you can see how the trend has continued on since, for the last couple of weeks here. It's worth noting that we're at over 120,000 hospitalizations, which is twice what either the spring or summer surges were. It's really those two put together, in fact. And that curve is not the kind of precipitous jump we saw earlier, but it is still steadily taking upwards. Midwest is trending down, but everyone else is still going up. Maybe there's a slight plateauing showing in the Northeast, but let's not get our hopes up for that. In terms of deaths, deaths were trending downwards in the Midwest before the holiday, with perhaps also some downward turn in the West as well. But death reporting is also significantly impacted by holiday shutdowns, so we should expect to not really have a clear picture for a while. We'll see some low days followed by some backlog days with spikes that will throw off our numbers for some time, but by mid-January, we'll have a picture of where exactly we are and what the impact of the holidays has been on the pandemic spread. In terms of developments, of course, there are those 2 weeks we're going to have of bad data. Also, there is a variant strain of COVID mostly identified in the United Kingdom, but certainly it has spread much further than that, which is believed to spread faster, just be more transmissible. It's not any more deadly or causes worse sickness. It just spreads more easily. And there is some research that suggests that it may actually spread as well, slightly better in children than the standard COVID variant does. In America, we saw about 2 million people receive their vaccines, the first dose so far, whereas worldwide, about 4.5 million people have received vaccinations. This is a great start, but we are moving a little bit slower than we had hoped. There had been some hope that we could get as many as 20 million people vaccinated. That's how many vaccines we're likely to have by the end of the year, but we're nowhere near being able to distribute that amount yet. But we should start to see vaccine drives ramp up in January. Also, experts, including Dr. Fauci, have been slowly kind of walking up the estimates on the percentage of people who would need a vaccine in order to reach herd immunity. Originally, we were talking somewhere in the 60 to 70% range, and now they're pushing it up to maybe 70 to 80% of people who need a vaccination. However, this is following an increase in the number of people who said they would get a vaccine once they become available. So we'll see how this plays out with more vaccines coming out, both in terms of more projects reaching completion and more production on our existing vaccines ramping up. And generally, as people see more vaccines deployed, it appears that people are becoming more willing to the idea of taking one themselves. And the percentage of Americans who said they would get a vaccine is creeping upwards, which is good because we need to hit that herd immunity threshold if we ever want life to resemble anything like it was in 2019. Just checking in with vaccines quickly here. So there are now 3 vaccines in widespread approved use, Pfizer, Moderna, and the Sinopharm vaccine. But we still have dozens upon dozens of vaccines in the works coming up soon. And in the new year, we'll start to talk about more of the other promising candidates that are hopefully going to finish trials in the near future. So you can always find our stats and trends, the usual sources. Mass.gov has all the Massachusetts information and has started to put out a vaccine tracker dashboard once a week in which you'll be able to see how many people in Massachusetts have gotten the vaccine. So far, it's around 35,000. You can go to covidtrackingproject.com for the graphs and New York Times for the raw case counts. One final thought, just a little for the holidays here. This is St. George testing dragon for COVID-19. And for more from the MassSupport Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands. We'll be here if you need us. We'll see you in the new year. Stay safe.